Hi, Plano. This is Shauna Haley. I'm the Director of Communications for the City of Plano, and I'm also one half of the hosting team for the Inside Plano podcast. COVID-19 dominates the news. Certainly it's dominating our lives, but even so, it can be really difficult to determine what's fact and what's fiction with all of the information that's coming our way. Dr. Mark Gamber, who is the City of Plano's medical director, gave a very informative presentation to the Plano City Council on March 17, 2020. We've pulled his presentation from the council meeting and we're sharing it here with you on the Inside Plano podcast. You can find information, resources, and answers to frequently asked questions that you're submitting to us on the City of Plano's COVID-19 website. We have put that URL here on the video, or if you're listening to the podcast version, you'll find it in the show notes. Please visit there. You'll find a lot of helpful pieces of information, and again, all of those frequently asked questions. The last time I checked, were more than 10 pages of questions that you've submitted to us since this incident began. Also, if you don't see your question asked there and you do have a question, please feel free to submit it to us. Ask Plano at plano.gov. As well, the city is posting on all of our primary social media channels, and you can always leave a question for us there. We are monitoring those channels nearly 24/7 and working to get answers to you. We know that this is a concern for everyone, and everyone has lots of questions. So without delaying any longer, I invite you to listen to Dr. Mark Gamber presenting to the Plano City Council on March 17th about COVID-19.
Thanks for the opportunity to address you. I'll tell you a little bit about what I've learned about COVID-19 with the preface that it's new to me too. And I've tried to read and learn as much as I can as a practicing emergency physician and having the honor of working with our fire department as well. And then I'll talk about access to testing and some of the dynamics that go along with that too. So coronavirus or COVID-19, coronavirus is a family of viruses. We think there's about 7 coronaviruses that live in humans, and this is the newest one, or the 7th. Right now we think there's 2 strains of coronavirus or COVID-19. We think one is worse than the other. It is transmitted from animals to humans. So the reason that's important, and the reason you hear the word novel, is because this is new, which makes it very different than influenza. Although it's transmitted in a similar fashion, our bodies don't know coronavirus like they know influenza. The human body has dealt with the influenza virus in various forms for hundreds of years, thousands of years, but we don't know this COVID-19 is new to us. So we have no natural immunity to it, and we have no vaccination for it. And that makes this year particularly dangerous because we're defenseless to it. There's not a medical treatment for it. You cannot take antibiotics, it's a virus. Antibiotics don't work on viruses. There's no antiviral that's known to be effective on this medicine at this time either. So I just want to describe some of the challenges that go along with this novel virus. I'll try and answer some basic questions that I've been interested to know the answer to also. The first is, what is the incubation period, i.e. how long do you have it before you might manifest symptoms? We think the average is 4 or 5 days. Now, you might manifest symptoms after 1 day and as late as 2 weeks, which makes this very challenging, but the average is 4 or 5 days. How long does it live on a surface? It can unfortunately live on a surface for a day or 2, depending on the type of surface. The good news story out of that, though, is it's exquisitely sensitive to soap and water and virucidal wipes and sprays and good hygiene. So not baby wipes, but virucidal wipes, virucidal sprays, hand washing will wipe it out. And that's why we all just have to keep preaching the mantra of cleaning surfaces and cleaning our hands and not touching our face. So you'll hear that message from me a few times more as we keep going here. What are the most common symptoms of COVID-19? Fever and dry cough are going to be your most common symptoms. Flu, if you've ever experienced the flu like I have, you probably remember the body aches that go along with that. That's a little less predominant with COVID-19. You have it sometimes, but it's what I would describe as a less common symptom. Dry cough and fever are the most common. I would like to specifically address that there is no not a significant gastrointestinal component to COVID-19 related to the run on toilet paper. Okay, you got to have a little humor in this whole thing. Okay, so I don't quite understand the run on toilet paper because this does not cause GI distress. How contagious is COVID-19? Well, it's more contagious than influenza. I think one of the facts that, I will admit I initially misunderstood as I thought, man, this is kind of a bad version of the flu. Well, true. It is. First of all, it's not the flu, it's a different virus. It is transmitted similarly to the flu in that it's a droplet spread, although we're still trying to rule out whether there's a bit of an aerosol to it and it can live a little longer in the air, more like a measles virus. What I can tell you is it's at least twice as transmissible as the influenza virus, probably even a little more than that. So now we're discussing a virus that is at least twice as easy to transmit, probably closer to 3 times as easy to transmit, and is more fatal. And that's why the concern is so great with this, and that's why we have to bend the curve on this. When we talk about fatality rate, I can tell you what we've seen out of other countries so far because we're very early in building our data set. For countries that have widespread testing, we're seeing anywhere from 1% to 6%. I think the WHO is settling out somewhere around a 2 to 2.5% fatality rate right now. That number is going to be a little ever changing as we have expanding testing. But let's put that in comparison to seasonal flu. Seasonal flu has about a 0.1% fatality rate, or 1 in 1,000. We're looking probably at a coronavirus or COVID-19 here that is 10x the fatality rate of what we have with seasonal flu. So 2 to 3 times as transmissible, 10x the fatality rate. That's why we're taking the extraordinary measures we are, and I commend what Plano's done so far. I think this city is doing a great job of protecting its citizens with the measures it's taken. Do you get immunity? Does COVID-19, once you get it, will you get it again? Unfortunately, it's more like the flu than like the measles or the mumps. So there's certain viruses you get it once and it confers immunity for life. And there's other viruses like the flu, you get it once and you might even get it once again in the same season, or you can get it the next season. COVID's more like the flu in that respect. If you get COVID this season, you could probably get a different version, a slightly different version as it mutates into the next season. So it's a year-on-year risk, and that's why we so badly need a vaccine, because even if the flu vaccine, even if it only works 40 or 50% of the time, that's 40 or 50% less chance you have to get it, and your immune system has some recognition, so it'll blunt the level of illness. What we've seen, different words are used like quarantine and social distancing, but what we've seen is that if you can separate people out, it works. In the countries that have been successful, when China bent the curve, when cities, states, and countries like Taiwan and Singapore and Hong Kong started doing this, they either slowed it from entering their country very significantly or bent the curve way down. We saw China really take drastic measures in late January, and within about 2 or 3 weeks, you saw the curve start to bend down from that. And I think that's where you see in some of the presidential addresses, the conversation starting to pick up and cities adopting it like we have. So I just wanted to endorse what we've done so far here in Plano, because I think it's been great. I think one of the things our citizens really want to know is, do I need to be tested? If so, where can I be tested? And I think that's one of the big challenges for us as a community right now. So if you're okay, I'll speak to that for just a minute, because it's changing every couple hours as to access point to testing. If you go back a month or two, the only access point was, or even I would say 2 weeks, I as a practicing emergency physician, I would call the health department if I wanted to test somebody, and I had to ask for permission for testing. And understandably, that's been a challenge for the health department. They had to protect the very limited number of tests that were available. There's something called VTM, or viral testing medium, that is in short supply right now. So if I wanted to order a test, I called the health department. If the health department said yes, the test went to the CDC, and I got the test results back in 7 to 10 days. We're used to 7 to 10 minutes with the flu test. Our citizens are used to going to the urgent care and the primary care doctor and the ER and getting a flu and a strep and getting the results pretty quickly. So this is, and to this day, there's still some delay, so I need to emphasize that. Things are getting better. The public health lab in the state of Texas can still probably limited to about 300 or so tests a day. We will call the public health lab. They are the fastest lab. From the public health labs, one is in Dallas, we can get the results back in about a day. But now private industry has really kicked in. We have a number of private lab entities that are doing testing. The turnaround time there has come down from 4 to 6 days to getting closer to 1 to 3, 2 to 4 days. So things are getting better. Even today, though, the testing is still limited. I talked to some very innovative physicians and the COO of Village Health Partners today, and they've been setting up, and I commend them for wanting to help the community out to provide access to testing, but they have a limited amount of tests they can do. So anybody who goes to get COVID testing today, there's going to be, if you do it as an outpatient, and I would encourage, I want to make this dichotomy, if you're sick, if you're short of breath, you need to go to the emergency department. You call the fire department, call 911, go to the emergency department. Okay, that's what we're here for. If you're not too sick, and that's a difficult individual decision to make, but if you have a cough and a fever, but you're walking around and feel a bit flu-like, I would personally prefer you look for an outpatient testing resource. The 20 to 30-year-old with a cough and a low-grade fever that goes to the emergency department and is in the waiting room with the 70 and 80-year-olds, the 20 or 30-year-old may be okay. The 70 or 80-year-old may die from that. So we need to encourage those that are sick and would like to get tested but functional to seek some outpatient options. So calling your primary care doctor is key. Like I mentioned, we've got some primary care doctors in this city that are now doing testing. It's come a long way since even last week. Call your primary care doc, and they may be able to do testing in an outpatient setting for you in a very individual, almost drive-through way to do that. The second piece would be there's a 211 number with the state, Department of State Health Services, 211 option 6. That's 13 hours a day, 7 days a week. They're happy to help you triage your symptoms and resources. We have every major healthcare system in this city, and every major healthcare system has an e-screening platform on their website and a hotline. So Baylor, Scott & White, you go to their website, you can be screened, and they have an outpatient testing option for you. Medical City, Texas Health Resources. So I just want people to be aware of those options as an outpatient as well.